And Dr. Ogechika Alozie joins me now. He's an infectious diseases specialist in El Paso, Texas, and a member of the Texas Medical Association COVID-19 Task Force. Doctor, welcome. It's great to have you with us. So, Dr. Birx, who is coordinating the current coronavirus task force, says that if you travel this holiday, you should assume you have COVID and quarantine. Is that the correct assessment?
Well, I think Dr. Birx has the right to say that, and I completely understand where she's coming from. I think one of the concerns I have with that messaging is like abstinence around HIV in the 80s and 90s, which didn't work because we didn't give people options. It doesn't give people options. I think a conversation has to be a lot more nuanced than that. We've gotten into this space where we message to people as if everything is black and white, and we have to give people options because what we've done in the past has failed. I think quarantining in some instances is absolutely the right thing to do. Testing may be the right thing to do. Wearing a mask consistently and physically distancing are also the right things to do. So I think there's not one message fits all in this situation.
And Doctor, you are in hard-hit El Paso. Talk to us about what you are seeing in the hospitals there. And are they able to prepare for what Dr. Fauci said could be a surge upon a surge following Thanksgiving? I mean, it's already been so bad in El Paso. Do you see it easing up, or do you think it will continue to get worse?
Yeah, so I think when we look at our data from the city and the county task force, what we're sort of hopeful about is we've had a decrease, probably about a 25% decrease in hospitalizations. Day-to-day testing has dropped dramatically, understanding that, of course, we just came out of a holiday weekend, and so that may pick back up. I think what we're hoping, and again, understanding hope's not a strategy, is that some people may have actually heeded the need not to have congregate Thanksgivings, right? The Black Friday concerns. And so if we can continue to go down, we'll see what happens really over the next 10 to 14 days. It's just too early to tell.
And what would FDA approval of the Moderna and Pfizer vaccines mean for overwhelmed hospitals? I mean, clearly we don't know exactly when they would get rolled out, but medical workers will be among the first to get vaccinated. So could this be a real game changer as soon as January?
Yes, I think it's important to understand that the vaccines are not going to change the people that we have in our hospitals now. We understand that cases beget hospitalizations, which unfortunately beget deaths. And so the people that are in our hospitals 21 days from now will have these tragic fatalities. What the vaccines will allow us to do, and it's really exciting, the data coming out of Moderna, is protect people going forward. Let's get that sort of first wave of healthcare workers and the immensely vulnerable vaccinated, and then plan on how to roll it out to the second and third waves. That's where the key will be to changing how we have hospitalizations look in Q1 and Q2 into the summer of next year. And I think it's really important for people to understand that because that gives them the hope to potentially change their behavior going into 2021.
And Doctor, several new studies are showing a possible virus mutation that could make the virus spread easier. Should we be worried about the virus evolving in terms of the vaccines? I know that these vaccines are special in that they can be tweaked a little more easily than others. So can we assume that the vaccines will be able to keep up with whatever sort of mutations this virus might take?
Yeah, so again, I think remarkable progress from the makers and the scientists. Kudos to them for an amazing year in creating these vaccines. And I understand where people get worried about this sort of genetic shift or potentially drift in the coronavirus. But we see this in the flu every year, right? And we make adjustments to the flu shot. Truly believe that Moderna, Pfizer, and a host of the other manufacturers that will be coming out with their vaccines later understand this, targeting the spike protein, and will be able to adjust. I think the key here is people should worry less now about that potential shift and mutation, but getting the vaccine. And let's figure out how to roll the vaccine out, not just to our population centers, but our rural areas and our places that are sort of challenged in terms of healthcare personnel and facilities. They're going to need it just as much and potentially more.
Right. The rollout will certainly be a challenge. Dr. Ogechika Alozie, thank you so much for joining us. We really appreciate your time.
Thank you very much.